Hello everyone and welcome back to another dissection guide. In this session, we're going to show you how to dissect the palm of the hand, and later we are going to show you the bones and the joints of the hand. I would like to walk you through actually the different parts of the hand. The hand includes the wrist, carpus, the proper hand or metacarpus, and then fingers or digits. Okay, so later I will show you the bones in here, but the carpus is made by the carpal bones, or the skeleton of the carpus, carpal bones. Then we have metacarpal bones here. Then we have the phalanges in the fingers. When it comes to the fingers, good to know that we have 5 fingers from lateral to medial, number 1, 2, 3, 4, 5. Thumb, index, middle, ring finger, and pinky finger. The thumb is pollex, then anything associated with thumb would be pollicis. The second finger is index, then anything associated with that indicis, okay? Or the fifth finger, which is digitus minimus, and anything associated with that is called digiti minimi, okay? Now, when it comes to the muscles of the hand, or the palm of the hand, they are divided in 3 groups. The thenar, hypothenar, and central. However, good to know that the thenar on the lateral side makes a prominent here, or like a bump here, known as thenar eminence. Then thenar eminence is made by thenar muscles. They are acting on the thumb. Then we have hypothenar eminence here, which is made by hypothenar muscles. They act on the pinky finger. And the central muscles, which include the adductor pollicis, lumbricals, and interossei muscles. So for our orientation, this is the lateral side, of course, that is the medial side. Okay, so we had already dissected the anterior forearm. We have come all the way down to where we have the flexor retinaculum. I'm going to expose that area and to show you the flexor retinaculum, and then carpal tunnel, and then we go with the skin incision on the palm of the hand. Okay, and then you can start to reflect the skin, okay, from your cut. Okay. I have removed the skin from the palm and the palmar aspect of the fingers, and I have removed the part of the fat here as well. I just want to show you the thickening of the deep fascia here on the palm of the hand. This structure is called palmar aponeurosis. Palmar aponeurosis. And as you see, the tendon of the palmaris longus muscle inserts to the palmar aponeurosis, or we can say palmar aponeurosis is the expansion of the tendon of this muscle. Doesn't matter which way you look at it. And also, before I continue the dissection here, I want to show you the digital branches of the median nerve coming to the finger. This is how they are coming to the finger. So when you reflect the skin from here, it's better you watch for these nerves and not cutting these nerves, okay? So now I'm going to go remove this fat as well as the palmar aponeurosis, okay? As you can see, there is a digital branch of the median nerve coming to the thumb. And good to know that palmar aponeurosis does not cover the thenar eminence and hypothenar eminence, or thenar muscles as well as the hypothenar muscles. They are not covered by palmar aponeurosis. Good to know that there are, see that tiny muscle fibers? This is palmaris brevis muscle, okay? It's one of the hypothenar muscles. Not very important at all, but it is here anyway. You can guess I'm in the medial side, and then practically the artery is ulnar artery, and the nerve here is ulnar nerve. Okay, both of them are passing superficial to the flexor retinaculum. Then they are not the structures inside the carpal tunnel. When you are reflecting the the palmar aponeurosis here, you have to be careful for the superficial palmar arch, which is right under the palmar aponeurosis. Okay, don't go deep here. See the fibers of the palmar aponeurosis. One of the tricks that I want to show you here is when you are reflecting the palmar aponeurosis, you may want to watch for a branch of median nerve on the lateral side to the palmar aponeurosis. You see that right here? See that here? Okay, then hopefully you're not cutting that branch. So it's the, removing the palmar aponeurosis is not easy process anyway. That is the superficial palmar arch. I will show you actually better dissection of that in a second. Okay, I thought maybe it's better I show you here before I remove the entire palmar aponeurosis. As I said, that is the ulnar superficial branch, this one, superficial branch of the ulnar artery. And then the superficial branch forms the superficial palmar arch. You see that right there? And look at here, right there is the median nerve. Okay, that's the median nerve coming to the palm of the hand. And as soon as it comes, it starts to branch off to the palmar digital, actually the common palmar digital, right there, these branches. And then this structure right here that I'm passing my scissor underneath, and I can show you it's coming from, or maybe I can actually do it from the other side. Okay, right there. That is flexor retinaculum. Then practically my scissor is passing through the carpal tunnel. Okay? Okay, that is the flexor retinaculum. Okay, and the tendon of the palmaris longus coming attached to the flexor retinaculum too. Okay, let me walk you through what we have done so far on the palm of the hand. So what we have found in regards to the thenar muscles on the lateral side. So this is the abductor pollicis brevis muscle right here. And medial to that right here is flexor pollicis brevis. And underneath of these two, practically is under the abductor pollicis brevis, this muscle is opponens pollicis. If I turn the specimen this way, I can show you right here, that is the opponens pollicis. Okay, these are the thenar muscles. When it comes to the hypothenar muscles, you had already seen the palmaris brevis, but the rest of the muscles here are this abductor digiti minimi right there. This muscle is flexor digiti minimi brevis right here, and underneath of these two right here is opponens digiti minimi. When it comes to the nerve and blood supply of the hand, on the medial side we have the ulnar nerve right here, okay, and ulnar nerve when it comes to the hand by passing anterior to the flexor retinaculum. This is flexor retinaculum that we have cut it here. So it passes through the superior, anterior to the flexor retinaculum. Here is the deep branch going deep, and then superficial branch right here. From the superficial branch, we have the digital, the common digital right here. As you see, it comes there. And then at the end it divides in two branches, goes to the sides of the pinky finger and the fourth finger, and also this one, which is proper digital, which goes to the medial side of the pinky finger. That's the ulnar nerve. And then ulnar artery divides two branches as well, the superficial and deep. Then from the superficial palmar arch, we have the common digital branches like this, like that, and then from the common digital they divide into branches to the proper digital. They go to the size of the fingers at the end. So hopefully I can do a little bit more dissection there that you can see them. So then on the lateral side we have the median nerve. Remember, passes through the carpal tunnel to come to the hand. So as soon as come to the hand, it gives off this branch, recurrent branch for the thenar muscles. And then we have the common digital branches like that. Then the common digital going down and divides in two branches for the size of the fingers here. So let me see if I can actually show you the common and proper digital and common digital here. Oh, right here. Okay, you see that? This is one branch and that is one branch. So then it's common here, but then it becomes proper. Okay. Okay. So as you recall, the ulnar nerve supplies 1.5 fingers, whereas the median nerve supplies the lateral 3.5. Medial 1.5 ulnar, lateral 3.5 median nerve, but that 3.5 and 1.5 pattern is for cutaneous innervation, for the skin of the fingers. For the muscles, the thenar, mainly median nerve, hypothenar ulnar nerve, and the central muscle that I will show you later is kind of both. And one more thing I want to show you here is the carpal tunnel is being open, and you see the tendon of flexor digitorum superficialis muscle. See that 4 tendon that you separate them from each other right there. See 4 tendon coming to the fingers, and deep to that here are the tendons of flexor digitorum profundus. Then 4 tendons of the flexor digitorum profundus. Okay, so they are all passing through the carpal tunnel. Then the content of the carpal tunnel, 1 nerve and 9 tendons actually. 4 tendons of flexor digitorum superficialis, 4 tendon of flexor digitorum profundus, and also the tendon of this muscle, which is this one, which is flexor pollicis longus. You see that right there? When I pull on the tendon, you see the movement of the thumb. Okay, so that is the tendon. Okay, as you recall, a group of the muscles in the central of the hand, you are considered as the central muscles of the hand, are lumbrical muscles. There are 4 lumbrical muscles. Here is the first one right there, and then we have the second lumbrical right here. And as you recall, the lumbrical muscles arising from the tendon of flexor digitorum profundus. I will show you in a second how they attach, or they are coming from the tendon of flexor digitorum profundus. Here is the second lumbrical, and then here we have in this space we have the 4th lumbrical right there. I mean the 3rd lumbrical, I'm sorry. And then we go to that space right here is the 4th lumbrical muscle. Okay, then there are 4 lumbrical muscles, and as you recall, the lumbrical muscles actually flex the metacarpophalangeal joints and extend the PIP and DIP joints, proximal and distal interphalangeal joints. Then practically is known as theta movement. Okay, theta movement. Okay, so since we are here, I also would like to show you this structure here, that the tendon of flexor muscles, they pass through a tunnel right there. Okay, see that right there? That is a tunnel made by the fibrous bands. My probe is actually inside the tunnel with the tendon of flexor digitorum superficialis and flexor digitorum profundus. So the tunnel is made by the fibrous band and the bone. So what I'm going to do now, I'm going to put actually a cut through the fibrous band and take the tendon of the muscles out of the tunnel. Okay, you can do that on your own cadaver when you are doing the dissection of the hand. So here it is. Okay, so 2 tendon off for the middle finger right here. Okay, right there. Remember, that is a lumbrical muscle attached to the tendon of the flexor digitorum profundus, and then the tendon of flexor muscles for the middle finger here. Okay, that is the tendon of flexor digitorum profundus. This is the tendon of flexor digitorum superficialis. Let me pass through this here, right there. Okay, here is the mnemonic for that if you want to recall. Remember, the flexor digitorum superficialis tendon divides in two to let the tendon of flexor digitorum profundus passing through. Okay, so then superficialis bifurcates and profundus tendon passes through that gap. Okay. Now I want to walk you through the deep muscles in the hand. Still, they are part of the central group. So one muscle here, this one is adductor pollicis with two heads. That's the transverse head right here, which has been a little bit ripped off here because that is the oldest specimen, and then that is the oblique head. So the adductor pollicis here. Then we have palmar interossei muscles here, like this. Okay, there are usually 3 palmar interossei. And then if I turn the specimen back here, you see the dorsal interossei. You see that these are real interossei muscles. First one, second one, third, and the fourth dorsal interossei. And in regards to the function of the muscle, as you recall, dorsal interossei are in charge of the abduction or dab. The mnemonic was dab. And then palmar interossei are in charge of the adduction of the toe, of the finger, pad. The mnemonic was pad. Okay. Let me walk you through the hand bones. As you recall, hand is made by 3 parts: the carpus, metacarpus, and fingers or digits. And the bones include the carpal bones here, metacarpal bones, and phalanges. So then practically carpal bones form the skeleton of the carpus. Metacarpal bones forming the skeleton of the proper hand, and phalanges form the skeleton of the fingers or digits. Now let's go with the carpal bones. By the way, for orientation, this is the right hand, that is the thumb, so the lateral side, and here is the medial side. So when it comes to the carpal bones, they are sitting in 2 rows, proximal and distal. In the proximal row, okay, 4 bones from lateral to medial include scaphoid, this one, lunate, triquetrum, and pisiform or pisiform. And then in the distal row, from lateral to medial, we have the trapezium, trapezoid, capitate, and hamate, this bone. Hamate has a little bony projection here known as hamulus, or hook of hamate. Okay, the thing is the carpal bones, when they articulate together, they are not actually forming a flat surface, but they form an arch, which known as carpal arch. So then practically, if I want to exaggerate the arch, the bones are sitting like this, okay? Then this carpal arch will be converted to a tunnel by extension of the deep fascia in the wrist, known as flexor retinaculum, to a tunnel. Then the tunnel is referred to as carpal tunnel. So in regards to the metacarpal bones, each metacarpal bone has a base, a shaft, and a head, okay, or proximal end, distal end, and the shaft. And same thing for each phalanges, the base, shaft, and head of the phalanges. And as you recall, the thumb has 2 phalanges, proximal and distal, whereas the other fingers have 3 phalanges, proximal, middle, and distal phalanges. Okay? Now, if I want to walk you through the joints made by these bones, Let's begin from here, actually practically from here. These joints made between the carpal bones are referred to as intercarpal joints. This series of joints here that made between the carpal bones and metacarpal bones are referred to as carpo-metacarpal joints. Then among them, the first carpo-metacarpal joints here right there is the most famous carpo-metacarpal joint because that is the only synovial saddle joint in the hand. Okay, this joint is a saddle joint, synovial saddle joint. Then going down, here we have the joints made between the metacarpals and proximal phalanges. We call them metacarpophalangeal joints, these joints, or knuckles actually. And then we have the interphalangeal joints right here. So then as you can guess, except the thumb that has just one interphalangeal joint, the rest of the fingers have two interphalangeal joints, proximal interphalangeal joint and distal interphalangeal joints. Have a great lab.